Yeah, hi, ladies and gentlemen. Once more, welcome back to my channel. This is Dr. Wan speaking, and today I am going to tackle a very interesting topic. Other than talking of diabetes, I will also talk about the gastroenterological tract, or call it your intestine, how they function. Because with diabetes, when it is not controlled, or when the blood sugar is unstable, fluctuating, or in roller coaster situation, you risk having what we call gastroparesis. Gastroparesis is a very important thing that has to be handled properly for diabetic patients, and that concerns your stomach. It concerns the small and large intestine, how they are functioning. So for them to function well, you need to make sure that your microbiome is in good order. So the microbiome meaning that the bacteria flora, they are 100% functioning. Otherwise, you'll be in trouble. For instance, constipation might be an issue. Borborygmus, meaning that you get some bubbling sound from your stomach, unexpected, which can create kind of discomfort when you're sitting with friends, especially in classrooms or in medical conferences. Your neighbor might sit next to you and get that sound coming from the stomach. So all those things, that's what I want to handle today. So the very first thing here, it is a microbial stewardship. So a microbial stewardship essentially talks about prebiotics. You all know what are prebiotics. There are some that you take twice a day, and there are another one that you take 3 times a day, another one you take 4 times a day, like the flucloxacillin. The flucloxacillins, you take them 4 times a day. That's every 6 hours. Whereas the other basic one is 3 times a day and also twice a day. So having said that, whether you are on the one that you take twice a day or 3 times a day or 4 times a day, they still do the same damage, in the sense that they wipe out the bacterial flora. So in this case now, we need to see how to rebuild it. We talk about intestinal re-education. How do you re-educate your bacterial flora? It's quite simple. The very first thing here, it is you do a combination. That is, you bring in prebiotics that do the groundwork, and then now you bring in the probiotics. So the pre comes first, followed by the pro. So when you put the two together, they now go to reactivate your microbiome and putting them in order. And like so, the bacterial flora now comes back to normal and stop that sound that you've been having in your tummy time and again. So having said that, I'm not by this saying that if you have diabetes, for sure you will suffer from borborygmus. But again, what might likely happen, it is stomach emptying. Stomach emptying, which in Latin we say gastroparesis. So paresis means movement, peristaltic movement. Normally our tummy are supposed to function that way, being in a peristaltic movement. So for those who have diabetes, when it is not controlled, the nerves are being damaged. When the nerves are being damaged, that's when constipation kicks in. So before constipation kicks in, you suffer from gastroparesis. A typical example is when you go for a party, you eat your best meal, and you discover that it takes ages for absorption to take place. That is, metabolism is quite slow. Slow because the nerves are kind of impaired by unstable blood sugar value. So to put things in order, you will need to actually reactivate the bacterial flora, because when they are all active, when your microbiome is at 100% functional, the good news is the brush border of the microvilli they tend to function also very well, and absorption takes place at 100%. When those brush borders are not functioning, you are in big trouble. So that's what I tell my patient. Please make sure you are on prebiotics and probiotics. You take them together to make things move better. It doesn't mean that you take pre and probiotics only at the end of your therapy on inline microbia. I would say no, no, no. Even when you are not on inline microbial, I still advise you once in a month, if you are a patient suffering from diabetes, to make use of them also. Except you want to tell me that your blood sugar value is okay, then that's fine. If it is spiking, pay attention, focus more on those things while you are taking your medication, for those who choose to do so. If you do not want to take it, please talk to your doctor. Make sure that the blood value is stable, your doctor is satisfied before you do whatever thing you want. Otherwise, keeping on by taking the probiotics, the prebiotics, and things should be fine. They are just there to help in emptying your stomach. That's the whole thing here. Otherwise, you run into trouble. Constipation will be at your doorstep, and so that's it. Physical activity also, that one is good. If at some point your doctor put you on a 9 microbial, then make sure that at say 2 days to the end of your therapy, you start taking pre and probiotics. What are prebiotics? Prebiotics are simple. In Africa, you have them, lots of them, like the banana. Banana is the simplest one. So just get an overripe banana, take it on an empty stomach, along with your probiotics. The probiotics, you can get it from the market. Typical example is Activia. Activia is one. If you don't want to spend so much money, just get Activia. Take one of the smaller yogurt container alongside with your overripe banana, and that should be fine. Make sure you do take them on an empty stomach. And the reason being that absorption is at top when your stomach is empty. When there's food in there, absorption rate slows. So that's why I always encourage each and every one to make it a habit of taking the pre and the probiotics on an empty stomach. So that's it for today, and I hope to see you again in my next video, and I look forward making things much more easier for you. And also I want to make sure that you are in good hands, your sugar value is stable, and that's it. Please do not forget to like and subscribe to my channel, share the link with loved ones, and remember, Dr. Wan is always here to help you as usual. Thank you and have a wonderful evening. Bye-bye.